Hi, everyone, and welcome to today's webinar on how to get more patient referrals for your healthcare practice. I have a couple of quick housekeeping notes before we do get started. I do want to remind you all to mute your microphones, and also we will be answering questions at the end of the presentation. So feel free to submit any questions in the chat or Q&A at any point in the presentation. Even if you can't make it until the very end, just submit your question and we'll make sure someone reaches out to you with an answer. But now that we've got that out of the way, let's get started. My name is Oliver Blanco, and I'll be today's speaker. I'm an experienced marketer here at Repigen, which is a healthcare reputation management platform that assists healthcare providers in improving their online reviews, patient acquisition, retention, and engagement. Before we do jump into the rest of the things that I wanted to cover today, I do want to go over the objectives of this webinar so you know exactly why we're here today. So in this webinar, we'll discuss what are patient referrals, why do patient referrals matter, how you can create an efficient patient referral program, and how to boost patient referrals and acquire more patients for your practice. To start off, let's talk about patient referrals and why is it important for healthcare practices. So patient referrals happen when a satisfied patient recommends your healthcare practice to their friends and family. Referrals can either happen naturally or even with a little nudge from your practice. Likewise, a patient referral program is a marketing system to acquire new patients by enlisting the help of your current patients. In short, this system brings new patients in the door while helping maintain prior relationships. With extremely low costs and a high chance of acquiring new patients, healthcare practices not utilizing a referral program are missing out on years of income. So now that we understand what patient referrals and word of mouth marketing are, let's move on to find out why it is important or why it matters. And specifically, referrals matter because healthcare organizations typically leverage all types of marketing and advertising strategies to acquire and retain their patients. But one of the best methods at building a strong patient base that they might not be using are patient referrals. And when researching for a new healthcare provider, 51% of patients find that referrals from family and friends are one of the most important factors in making their decision. This means that happy patients spread the word of their positive experiences to their friends and family, which is highly trusted and considered important in their decision-making process. Another 2014 study published by JAMA found out that more than 1/3 of participants rated word-of-mouth referrals from either physicians as well as friends and family as very important in choosing healthcare providers. In this age of healthcare consumerism, patients look to Google, social media, and physician rating websites to find healthcare information and take control of their care options. Even so, word-of-mouth referrals and recommendations are still a key factor in patients discovering you. And that's because patients trust the opinions of family and friends over actual paid marketing campaigns. That's what makes word-of-mouth patient referrals so powerful. When your patients know you, like you, and trust you, they'll be more likely to rave about you to others, thus increasing your chances of new patients coming to you. So the more you can stand out as an exceptional provider, the more likely your patients will send referrals your way. So now that we've covered why they matter, let's go over how to create an efficient patient referral program. First, take a look at your overall patient satisfaction. As long as your patients are generally happy with their care, you'll be more likely to receive referrals. And once you establish that patients are generally happy with their visits, then you need to make sure that your staff ask your happy patients for referrals. Next, document a plan with tangible goals, such as a plan to acquire at least 3 new patients for referrals, for example. This will help your entire team know what to aim for when asking for referrals. Next, place signs around your practice for patients to see during their visits and give your staff clear directions for talking about referrals. Likewise, you can also consider running some campaigns, such as a series of emails, text messages, or even phone calls to ask current patients for referrals. And lastly, as a special tip, try using incentives if you can. Things like gift cards and discounts can go a long way towards patients referring you to others. But some states have laws that prevent practices from offering incentives. So just be sure to do your research. And if you are able to offer incentives, try them out. Continuing on, some additional steps you may want to take to ensure a successful patient referral program are: one, engaging with other practices, especially for the purpose of acquiring more referrals from other healthcare providers. Engaging with other practices in your area and establishing trust with them can help funnel new patients to your door. Two, utilize tools to automatically ask for referrals. Automated email campaigns, phone calls, and there's a whole bunch of other tools out there that can help even the busiest of practices stay on track to acquire more referrals. Three is creating promotional material. So you can create additional material like flyers for patients to take as a reminder, as that can help jog their memory after a visit and encourage referrals. Now that we've gone over how you can create an effective referral program, let's discuss how you can proactively boost patient referrals and start acquiring more patients for your practice. And to do that, you start off by one, simply just asking your patients directly for referrals. The best way to increase referrals is to simply ask for them. And unless you directly ask your patient to refer their friends and family members, they might not even remember to. So to make this process easier, consider giving patients printed instructions that outline how they can make referrals. Two, always aim for an exceptional patient experience. The Agency for Healthcare Research and Quality explains that patient experience as a range of interactions that patients have within a healthcare system, from people to processes. Although your appointment scheduling might be a breeze, your wait time is minimal, or your bedside manner outstanding, it will take an exceptional experience to get people to spread the word about you. You'll need to pay attention to every touch point along the patient journey, which can include from when a patient first comes to your website, the scheduling process, the actual visits, follow-up, aftercare, and even billing. Interestingly, Physicians Weekly notes that 91% of patients who are fully satisfied with their billing process would recommend their physicians. It's also important to make sure you hire staff who provide the same high level of care as you. Train your staff to answer the phone politely, greet all patients with a smile, return phone calls in a timely manner, and show compassion throughout the entire appointment. Three is deliver excellent patient care. Going above and beyond to deliver high quality care can set you apart from your competitors. By exceeding patient expectations, patients will be more likely to share their experiences with others through better health outcomes or personalized care. Do your best to make each interaction with patients positive, from just the scheduling stage to even after visits and follow-ups. Four is network with other physicians. The data science team at the healthcare data company Amino found that doctors specializing in internal medicine made over 63 million referrals in 2016. These internist referrals can be your bread and butter if you establish yourself as an expert and a trustworthy provider with whom they'll want to be associated. So networking with other physicians in your area at healthcare conferences and local businesses, meetups, as well as on social media platforms like LinkedIn and Twitter can go a long way. Frequent one-on-one chats with primary care physicians over coffee or drinks can also go a long way in building relationships and increasing the likelihood of receiving referrals. Number five, again, is incentivizing patients. There are patients who will sing your praises to everyone and anyone they meet, but they're an exception. Most patients, despite being extremely satisfied with their care, need an incentive to take action. While the American Medical Association's Code of Medical Ethics says financial or valuable incentives, again, should not be offered to patients in exchange for referrals, patient loyalty programs can work. Per a 2016 JAMA study, participants in loyalty programs often provide positive referrals, encouraging others to frequent the company or experience a product thus enhancing customer base and revenue. These programs benefit your patients as they are rewarded for their loyalty, and they benefit your practice by increasing your opportunity for word-of-mouth referrals without compromising patient trust. Number 6 is just tracking important metrics. Track important metrics to find out how effective your referral program is. See what referral marketing strategies are working or not working, and then improve your processes from there. Number 7 is collecting patient feedback. Post-visit patient satisfaction surveys are becoming common practice for healthcare providers for several reasons, but most notably to help improve their online reputation. While it can be difficult to measure how much your patients enjoyed or disliked their experience with your practice, using surveys written specifically about your practice and for your patients can provide you with both qualitative and quantitative data, which can be used to tangibly improve your practice and online reputation. For example, Refugen's automated patient satisfaction survey tool has an inbuilt patient survey feature. You'll be able to identify areas of your practice that need to be improved, manage your online reputation, and boost engagement rates, ultimately making patients feel more compelled to refer you. And the last step is just to automate the patient referral process. With so many healthcare providers busy with providing quality patient care to their patients, automating the process will take a huge responsibility off of your shoulders. So for example, Refugen has a patient referral feature that automatically sends customizable referral requests through text and email to patients that have had a positive experience. I've included an example referral email on this slide, as you can see, and it tells the patient how happy the doctor is that the patient had a positive experience and asks them to refer their friends or family to their practice. From there, the patient just needs to click on refer a friend and share the practice's contact information with their friends and family so that they can set up an appointment. So overall, using an automated referral process like this will help streamline and track the effectiveness of patient outreach, ensure you're reaching out only to happy patients, and assist with acquiring more patients at your practice. And that is everything that I wanted to cover in today's webinar about how to increase patient referrals for your healthcare practice. So to quickly summarize what we covered today, here are some key takeaways. Firstly, 51% of patients, again, trust the referrals from their friends and family, and word of mouth is one of the most influential deciding factors in choosing a doctor. 2, it's important to provide an exceptional care and excellent service to patients to keep them happy and coming back. In short, the more you can stand out as an exceptional provider, again, the more likely your patient will send referrals your way. 3, creating an efficient patient referral process, removing any roadblocks should be the topmost priority for any provider or practice. And lastly, taking the appropriate steps to boost your patient referrals and improve patient acquisition. You can follow these steps again, which are asking your patients directly for referrals, just providing an exceptional patient experience, networking with other physicians, incentivizing patients if you can, tracking important metrics to make sure that your referral process does work or doesn't work, and then taking actions on that, collecting patient feedback, and then lastly, using an automated patient referral software solution. And just to tell you a little bit about ourselves, Refugen is an all-inclusive reputation management platform that will streamline the referral process we went through today to help you implement an effective referral marketing program. We also offer add-on services to assist with patient engagement, monitoring, and improving patient satisfaction, leveraging reputation with marketing solutions, and a lot more. Lastly, I do want to let you know that we are currently having a promotion going on that offers a 90-day money-back guarantee. So if you do sign up with Refugen and your online reputation is not improved within 90 days, you'll be entitled to a refund of all monthly fees. So to take advantage of this promotion, feel free to email us at info@refugen.com, or if you just want to learn more about us, visit our website at www.refugen.com. But now that I've covered everything in today's webinar, I'll open it up to some Q&A. All right, so the first question that we got today is, do referrals from patients actually matter? And the answer is yes. Again, with 51% of patients finding that referrals from family and friends are one of the most important factors in making their decision, referrals can make up for a huge portion of your patient base, which is why it's important to ensure you have a strong referral process in place. All right, so we got another question. The question is, when should I ask my patients for a referral? And that's a great question, actually. So the best time to ask a patient for a referral is after their appointment, and only if they were satisfied with their care that they received. By asking your happy patients soon after they finish their appointment, they will be able to share their positive experiences with others while the appointment is still fresh in their mind. All right, another question that we received is, how can I make sure my patients refer me to others? And that's another great question. So while it might be impossible to make sure that 100% of your patients refer to you, setting up the proper referral game plan can help you get close to that. And that is why we recommend training all of your staff members to ask happy patients for referrals, putting up signs around your office to remind patients to refer to their friends and family, or even using an automated referral system so that your satisfied patients are automatically asked to refer you without having you to constantly ask your patients yourself. All right, another question. The person stated, I think you mentioned that there are some states that don't allow referral incentives to be used. How do I know if my state doesn't allow incentives? And that's a very good question. So the way how I would suggest starting your research is with a simple Google search and type something like, can I offer incentives to patients for referrals in my state? Then depending on whatever pops up on the search results on Google, you can decide whether or not you'd like to offer incentives at your practice. All right, we received another question. Question is, will patients actually leave referrals if I just ask them? And as simple as it sounds, yes. In fact, you drastically increase your chances of patients referring you to others by just asking them. Typically, happy patients just tend to go on with their day if they were satisfied with their appointment, and they don't even think about giving back to you. So just by simply asking them nicely to refer others to you, patients would tend to refer you since you did such a great job for them. I'll give it another minute or so to see if any other questions filter through. All right, so I believe that's all the questions for today. So thank you all again for attending today's webinar. Again, if you have any questions or are interested in learning more, feel free to email us at info@repigen.com or just check out our website at www.repigen.com. Thank you all again and have a great rest of your day.